Okay, so our first case study is for a 37-year-old male who has a grade 1 supraspinatus tear, so it's a rotator cuff injury. The main goals and the results we're looking for through the program, through the strengthening program, is to improve glenohumeral strength and scap stability and strength as well. Okay, so they're the ultimate goals. So for a warm-up, I'll just prescribe a nice easy row. So we're looking for a nice straight back posture and just a nice easy level just to get strength and a bit of just to warm up the whole upper body, especially through the shoulder joint and scap. So 5 minutes on there, and then I'll just give just a leg press just for a bit of balance throughout the full body. So we just won't work the shoulder, we'll also add a bit of balance in there for the full body routine. So then we'd go straight, once the body's warmed up, we'd go straight into a modified row. So we're looking to improve obviously strength through the scap and get some strength through the shoulder as well. So we're just going to say the right side is the injured side. So just having a medium resistance band here, resistance band, you can obviously use a cable on a cable setup as well. So we're looking for shoulder height, nice straight arm, and we're just looking for a modified row with using the cable. So rather than flexion through the elbow, we're just looking for scap movement through here on a fixed plane and slight rotation round. So we're looking for endurance as well. So we look for about 15 reps, movement through here and return to the start. So I'll just get Kelly to just demonstrate that. So again, we're looking for a nice even line here, and we're not looking for too much resistance here. Obviously we'll progress that as the program goes and the weeks go through. So it's just a modified row on the injured side and just a little bit more rotation back, so just a little bit more movement to really look for that scap strength and stability through here. Maybe even hold it for a couple of seconds and release. Nice and strong through here for your balance as well. So that would be the first sort of rehab strength movement that we'll do. Then we could even progress to the cables just for a double hand row and use a little bit more load, but obviously the other side is going to be assisting. From there we would go to an isometric wall push-up. So obviously an isometric means there's load going through the injured area, but there's no movement, there's no joint movement. So it's just a matter of having the injured area and trying to push the load away, so an abduction from the body, and we're looking to force a bit of strength and endurance through the shoulder that way. So it's just a push, hold for 5 seconds and release. So obviously the endurance and the strength, but obviously no joint movement. But then we can progress through the cables again to some abductions at a low resistance. So Kelly, if you just wanted to come here, just have your injured area with your wrist on there, and it's just a matter of trying to push this away, but having no movement through here. Push as hard as you can, so we're gaining some strength through your shoulder and through your rotator cuff, holding for 5 seconds, and relax, just for a set of 10 to 15 again, push away, and relax, okay? So we just do that on the one side. The next exercise would be to get a bit of mobility through the shoulder and the scap as well. So we could either use a tennis ball or a really light weighted ball on here. We would just have, again, our arm at a horizontal position through the shoulder. So we'd be looking at starting off, obviously there's no weight in this ball, we'll be just looking at getting some mobility and strength through the shoulder. So just drawing circles on the wall really slowly. Again, this is endurance based as well. So working the scap through its full range of movement, through the shoulder, through the full range of movement, and just try and get a bit of strength through that whole area. We try clockwise, anti-clockwise, and then progress to some figure eights. So full movement through joint stability as well. So Kelly, just want to go on that. So straight arm, just a little bit lower, so that's it. So it's just a nice straight arm. We'll just push a little bit of pressure through to the ball, and we'll just start with, you can just vary it through large circles, small circles. It's just a matter of getting a little bit of stability, endurance, strength, and movement through the whole area through here, just to increase strength through the scap and the shoulder itself. Okay, so that's the progression would be to, which we would use as our main testing tool, would be a heavier object and different movement patterns. So that's the circles on the ball, either with a tennis ball or a really light ball like so. Final one, just to get a bit of strength and mobility through the area, is a scap push-up. So we'll just be on hands and knees, nice neutral spine. And instead of obviously going through a normal push-up routine, we're just looking to drop a chest to the floor, squeeze the shoulder blades together, hold, and then push up. So it's a really modified push-up, looking straight ahead, dropping the chest to the floor, squeezing the shoulder blades together, again recruiting a little bit of strength and mobility through that area, and coming up to the start. So Kelly, if you just wanted to just demonstrate this final one. So a nice neutral spine, so we're looking just to drop our chest to the floor, squeezing the shoulder blades together, drawing a bit of strength and endurance through that area, and coming back to the start. Beautiful. Focusing on bringing the shoulder blades together, recruiting as much strength as we can through this area, through the trapezius, through the shoulders, and through the shoulder blades. One more. Nice tight squeeze, dropping the chest and holding that position, and resting. Okay, so that would be the main strength routine we would go through. We'd probably put an upper body row just for a bit of endurance, maybe a 30-second stand, maybe 30 seconds forward, 30 seconds backwards, to get a bit of resistance through there on a medium level. So just full shoulder mobility, going one way, stopping, going the other way. So again, we're working that whole area through the back. Treadmill at the end just for some nice easy cool down, and then maybe some stretching at the end to finish.